Did you know that according to the CDC, 47% of Americans have high blood pressure? That's nearly 1 in 2 people. After learning that 47% of Americans have high blood pressure, you might be wondering, do I have high blood pressure? What are the signs and symptoms? Well, we have them for you. Are you experiencing nagging headaches that just don't seem like they want to go away, even if you're not stressed? Are you having frequent nosebleeds that seem to be random and reoccurrent? Are you suddenly having vision problems, even if your prescription is up to date and your glasses are just fine for your eyes? Or how about random dizziness with no known explanation? If you are having any or all of these symptoms, it might be the right time to call your personal care physician and schedule an appointment to go in to have your blood pressure checked. When you go in to see your doctor, the first step that they'll take is taking your blood pressure. This can tell you if you do or don't have hypertension. When you go to the doctor, they will check your blood pressure, and you should be in the normal range of about 100/80 to 140/90. Anything higher than that is a state called hypertension, aka high blood pressure. After your doctor determines if you do have hypertension, they'll sit down with you to discuss which medications are right for you and for your treatment. Your doctor may decide that lisinopril is the right medication to help treat your hypertension. Lisinopril also goes by other names, such as Prinavil, Cuberlus, and Zestril. Lisinopril's therapeutic use is antihypertensive, but its pharmacological use is an ACE inhibitor. You might be wondering, what is an ACE inhibitor? Well, an ACE inhibitor is an angiotensin converting enzyme that helps relax veins and arteries, which leads to lower blood pressure. The typical dosage of lisinopril for adults is 10 milligrams a day orally, and it can be up to 20 to 40 milligrams a day, depending on your needs.
Patient teaching. Take medication as directed by your healthcare provider. Take missed doses as soon as remembered. Avoid salt substitutes containing high levels of potassium. Change positions slowly to decrease orthostatic hypotension. Notify your healthcare provider of all other medications and vitamins. Notify healthcare provider immediately if rash, mouth sores, sore throat, fever, swelling of the hands and feet, difficulty swallowing or breathing occurs. You also want to drink plenty of water while taking lisinopril. Assessment. Monitor blood pressure and pulse frequently during initial dose adjustment. Assess patient for signs of angioedema. This may occur anytime during therapy. If you didn't know, an angioedema is swelling beneath your skin, often a result of an allergic reaction. Monitor weight and assess patient routinely for resolution of fluid overload. Lab values. Monitor BUN, creatinine, and electrolyte levels. If increased BUN or serum creatinine concentrations occur, dose reduction or withdrawal may be required.
Nursing implementation. Correct volume depletion, if possible, before initiation of therapy. Precipitous drop in blood pressure during first 1 to 3 hours following the first dose may require volume expansion with normal saline. Monitor closely for at least 1 hour after blood pressure has stabilized. Resume diuretics if blood pressure is not controlled. The oral solution is clear to slightly opalescent. Administer without dilution.
Side effects include dizziness, fatigue, headache, weakness, hypotension, chest pain, rash, hyperkalemia, abdominal pain, diarrhea, nausea, vomiting, erectile dysfunction, impaired renal function, cough, and angioedema. We already know patients with hypertension take lisinopril to treat it, but what other kind of patients can also take lisinopril? Lisinopril is prescribed after a heart attack and also in diabetic kidney disease. Lisinopril can also prevent future strokes and heart attacks.
After learning all this information about lisinopril, you might be asking, what can lisinopril do for me and my hypertension? Well, lisinopril will treat the hypertension and reduce the blood pressure to a normal level, which is, again, 100/80 to 140/90. And now it's everyone's favorite part, NCLEX question time. I know, we didn't want to do this either, but it was on the rubric, so it's on here. So let's get to our 2 questions. Our first question of the day is, the nurse is planning to teach the patient about lisinopril. Which of the following electrolytes should the patient avoid while taking lisinopril? A, calcium, B, potassium, C, bicarbonate, or D, phosphate? We'll give you a few seconds to figure out your answer. So now, I hope you guys have the answer. If you chose B, potassium, you're correct. The rationale for this is, this electrolyte can cause hyperkalemia while taking lisinopril, which can lead to serious heart problems and/or death. I really don't think anyone wants to die, so just avoid potassium if you're on this. Our next question is, what are the signs and symptoms of hypertension? Select all that apply. A, a blood pressure over 140/80, B, a headache, C, blurred vision, or D, excess urine output. And yes, this was at the beginning of the commercial. If you chose A, B, and C, you're correct. A blood pressure of 140/80 is a hypertensive state, and headaches and blurred vision are both caused by excess pressure in the veins and arteries while you're in a hypertensive state.